Sadness is a normal human emotion. We all experience it from time to time. It is often triggered by a specific event, like a disappointment or loss. Sadness usually fades with time as we process and heal. Depression, on the other hand, is a serious mental health condition. It is not merely feeling blue. Clinical depression is persistent and pervasive, often lingering for weeks, months, or even years. Unlike sadness, depression doesn't always have a clear trigger. It can manifest even in the absence of difficult life events. It's important to remember that depression is not a sign of weakness. It is a medical condition that requires professional attention, just like any other illness. Recognizing the difference between sadness and depression is the first step towards seeking appropriate help. Depression casts a long shadow over many aspects of life. It impacts how a person thinks, feels, and behaves. The impact is not limited to mood alone. It seeps into daily activities, relationships, and overall well-being. Many people with depression struggle to find joy in things they once loved. Hobbies and passions lose their appeal. Simple tasks like getting out of bed or preparing a meal can feel insurmountable. The fatigue associated with depression is not just tiredness, it's a deep, pervasive exhaustion that sleep often fails to alleviate. Concentration becomes a challenge, making work or studies difficult. The world might seem bleak and hopeless, leading to social withdrawal and isolation. While the experience of depression is deeply personal, its roots run deep into our biology. Research has shown that depression is not simply all in your head, it is intricately linked to physical changes in the brain. Studies have revealed differences in brain structure and function between people with depression and those without. For example, some areas of the brain like the hippocampus, involved in memory, and the prefrontal cortex, involved in decision-making, may be smaller in those with depression. Furthermore, depression is associated with an imbalance of neurotransmitters, the chemical messengers in our brain. Serotonin, dopamine, and norepinephrine, all crucial for mood regulation, motivation, and feelings of pleasure, are often found in lower levels in people with depression. This complex interplay of biological factors highlights the fact that depression is a real illness with tangible effects on the body. It is crucial to remember that depression is treatable. Seeking help is not a sign of weakness, it is a sign of strength and a desire to heal. If you recognize the symptoms of depression in yourself or someone you care about, reaching out to a mental health professional is essential. There are effective treatments available, including therapy, medication, or a combination of both. Supporting someone with depression requires empathy, patience, and understanding. Encourage them to seek professional help and offer practical assistance in finding a therapist or navigating treatment options. Avoid dismissing their feelings or comparing their experience to everyday sadness. Remember that recovery is a journey and setbacks are a normal part of the process. By fostering open conversations about mental health, we can help reduce stigma and create a more supportive environment for those who need it most.